Good afternoon. This afternoon we'll be talking about the Kahuku Medical Center on the north shore of Oahu in Hawaii. In 2007, this hospital was shut down for infection prevention reasons. This hospital is the only emergency care facility on the north shore, and by having it shut down, it greatly inconvenienced tourists, surfers, and locals who may have needed emergency care. These are people that could have had life-threatening injuries, and if you did have a life-threatening injury or sickness, you had to be transported more than an hour away to Honolulu, either via air or automobile. And this just, when you're in emergency situations where time is of the essence, you are finding that time that time saved could have saved your life. So it was imperative that the Kahuku Medical Center stay open, even though they were being shut down because their hospital was so dirty. The state healthcare corporation had to come in and start operating the hospital, but they found that the infection rates did not go down. We will be talking today about how we were able to change the cleaning protocols and the cleaning solutions for that facility, and how after now 9 years they have 0 readmissions for hospital-acquired infections. I am a regional sales manager for a company called Genion Technologies. We installed this system, the first one at a U.S.-based hospital, at this Kahuku Medical Center, and we'll be going through today what they did previously, how they're doing it now, and how we can help save the healthcare community in the United States billions of dollars a year. Our technology physically kills the bacteria that cause staph, MRSA, C. diff, ringworm, impetigo, norovirus, and many other bacterias. And as I mentioned, since Kahuku has installed, they have found much better results and a much cleaner facility. They were losing over $200,000 per year in infection-related expenses and needed a new way to clean their hospital. According to the CDC, again, this is from the Center for Disease Control, cdc.org, the cost of hospital-acquired infections is in the numbers of about $28 to $45 billion per year. There are over 2 million patients affected annually, and over 90,000 of those will die. And these are infections that are acquired in the hospital, and you get while you're there for some other reason. The reason it is so expensive is because those dollars are dollars that cannot be billed to other people. If you get infected in the hospital, they need to take care of you on their dime. So if you are in a bed and they are treating you, that's a hospital bed that can't be used by somebody else. It's money that is being eaten by the hospitals, and they are contributing to it because of their own cleaning protocols. Kahuku at that time, of course, was not profitable. They were losing lots of money every year because they were so dirty. But they were also doing everything that they could do, everything that was required with their current cleaning products and protocols in having a clean facility. As we went in and we reevaluated what they were doing as a hospital, we found that they were trying a one-step process, which is clean and disinfect, and that's just a fallacy. These are cleaning products where you have to clean first and then sanitize. You can't sanitize poop. Poop is dirty. You have to clean the surface and then sanitize the surface after it's cleaned. And so we went in and had to change the way they were cleaning their hospital. As I mentioned, they had a very high infection rate. They were almost a 1 in 5 chance. So if you got admitted into the hospital, you had a 1 in 5 chance of getting a life-threatening infection. These numbers are similar to anywhere where there's socialized medicine, whether it be Canada, Great Britain, Australia, France. These are numbers that are not good for the health of the patients. The solutions that they were using as best they could, but as you read the label and read the instructions, they were not using their solutions properly, and they were not using protective equipment, and were not changing out their cloths and their mops as often as they should. We found terry cloth rags instead of microfiber, and while terry cloth is very good at removing a buildup on a surface, it's not very good at being antibacterial. So we changed from terry cloth to microfiber, which is antibacterial. We changed their mop heads from terry cloth to microfiber. We changed their processes. They were using one mop head for the whole day. They were mopping in the restrooms and then going out and mopping in the hallway and then mopping in the patient rooms and just spreading bacteria all throughout the hospital. And we were then able to have them change the mop head every time they every time they cleaned a room, every time a patient was admitted, every time they changed from a private area to a public area, and we found a much less bacteria in those facilities after the changes. We did an ATP meter counts before and after. An ATP is just an instrument that counts the amount of living organisms on a certain surface. And anything above 50 is considered dirty, anything above 200 is considered contaminated. And before we started, consistently, their ATP meter readings were between 300 and 1,000. After changing and updating their cleaning protocols and their cleaning solutions and their cleaning supplies, they found that their previous way of doing business was adding significantly to their facility infection rates, their employee absenteeism, and how quickly they were doing their jobs. With the new training protocols and the new water-based solutions, they were able now to save 25% of their labor costs because they were cleaning quicker. The solutions that they were using, again being water-based, were safer for their employees, and by being able to dial in the pH levels and the free available chlorine levels of their cleaning solutions, we found only 30-second dwell times rather than 3 to 10-minute dwell times to kill bacteria on certain surfaces. So as we changed out the cloths, as we changed out the mop heads, as we used the cleaning protocols that were suggested in Infection Prevention Today, it's at infectionprotectiontoday.com, we were able to save them time and money and use an environmentally friendly solution with which to clean their facilities. As we started swabbing afterwards, we noticed ATP readings in the single digits. We were getting ATP readings now under 10. We were found that they had an extra 2 hours a day. Through an 8-hour day, saving 25%, an extra 2 hours a day where they were able to effectively do maintenance on their building rather than just mopping floors and scrubbing toilets. These solutions that we used, like I said, we could dial in the pH level that made it safe for the employees but hazardous on the bugs. And we were able to then take this solution, which was EPA registered with the state of Hawaii as a disinfectant, and after cleaning, a month later, go in and keep cleaning and swabbing. The results of those studies came back very positive. We had a 96% reduction in bacteria in the hospital. There was a time savings of, like I mentioned, 25%, less workman's comp claims, less absenteeism based on allergic reactions and mixing or misuse of their chemicals. And we had those those numbers taken to a statistician to be analyzed for us, and we found that there was a 97% probability that the improvements in the hospital for the cleaning solutions and the cleaning protocols led to a savings of almost $250,000 per year in the profitability of that hospital. As a result of the change in solutions and protocols, they are now saving that $250,000 a year. And as I mentioned, since 2009, when we installed that cleaning protocol and solution into their facility, they've had 0 hospital-acquired infections. They have now gone from the worst hospital in Hawaii to the best hospital in infection prevention and in maintenance and in employee satisfaction, because the employees see that they are being given environmentally friendly solutions and value their employees' health and time. These bugs that we're dealing with are super and they're smart, but we need to know that the human race is smarter and more super than these bugs. And as we have found the success that we've had in Hawaii, we are now working with other healthcare facilities, long-term care facilities, rehab facilities, school districts in working smarter and not harder for their employees' health, for their facility health, and in saving money. I would encourage anyone who is in building maintenance, who is in business productivity and business profitability, to look at these solutions as they are renewable, they are safe, and they are effective at cleaning facilities, physically killing bugs, and making the future better for us, our facilities, and our children. Thank you.